Hi gorgeous girls, it's Morgan and thank you for joining me. This video is all going to be about looking at breastfeeding from a historical perspective. Okay. So I want you to picture the time back before there was formula to supplement a baby's feedings, as well as before there was medical interventions to stop a mom from bleeding after birth. Can you kind of imagine how birth was back then? It was kind of a scary thing. Mortality rates for babies and for moms was quite high. It was also a very dirty environment. Now, after the baby is born, babies are born with a very weakened immune system because they've never been exposed to any sort of pathogens. But that is exactly why a mom's body creates that super dense colostrum. Okay. Colostrum, as we know, is very dense in antibodies, growth factors, things like that, protective enzymes to give that baby as much protection as possible in a very small amount. Baby doesn't have to nurse very much, only needs a few drops, and gets that very first inoculation, as it would be, against the pathogens in that very dirty environment to when it was born. So in essence, mom is, by breastfeeding and giving that colostrum to the baby, is saving the baby, or trying to save that baby's life from infection by giving it those antibodies. In turn, since mom's body is that we didn't have the interventions to stop a mom's from bleeding, when baby breastfed, not only does it release the prolactin to increase her supply, but also it releases oxytocin. Now, oxytocin is a smooth muscle contracting hormone. It's the hormone that guided that mother's lovely contractions during labor. After delivery, the oxytocin is used to contract the uterus and slow down or stop a mom's bleeding after childbirth. That's why if you've ever had a multip mom that is having cramping when breastfeeding, that's essentially the baby's way of trying to save a mom's life from a sanguination after having this childbirth. So in a way, by breastfeeding, the mom is saving the baby's life from potential infection, and the baby is saving mom's life from bleeding to death after childbirth. But it's not just a one and done type of thing. That little one needs constant small doses of that antibodies, as well as mom needs constant small doses of that oxytocin to help control her bleeding after birth. This is exactly why skin to skin, or in promoting skin to skin, is super important and biologically where the baby is just meant to be. It's looking at just from biology and how the baby and the mom's bodies just work symbiotically together and how they fit together. The baby should be nowhere else but on mom's chest. Getting those frequent doses of antibodies and colostrum for the baby, and giving mama that frequent small doses of that oxytocin. Okay, so it's really cool thinking about the history and biology of how the mom and baby relationship fits together in kind of a biological way. I think it's pretty neat. I hope you think it's pretty neat, and feel free to share it with patients if you're trying to promote that skin to skin and feeding on demand, just bringing it back to the basics of just naturally how our bodies are designed to be. Okay, see you all at the next video.